For patients who have come to cardiology, had a virtual angiography, undergone an angiogram, had a stent placed, or started medication, there is only one real question on their minds. Can plaques regress? Can plaques disappear? Is there anything that can dissolve these plaques? Anything that can eliminate them? Let's see, can we actually eliminate these plaques? Let's talk about it. Heart vessel plaques, or atherosclerosis, are cholesterol deposits that bulge into the inner part of the vessel as a result of damage to the vessel. You could call it a kind of fat accumulation. In other words, what we call a plaque is a mass of cholesterol that protrudes into the vessel. It is a cluster of fat, and its surface is covered by a single layer of cells called endothelial cells. In other words, the structure that covers the plaque and prevents it from spilling into the vessel is the endothelial cells. And beneath these endothelial cells is a capsule called the fibrous cap. As this capsule thickens, plaques are less likely to rupture. If the capsule is thin, plaques can rupture. The thickness and strength of the capsule, that is, whether your plaque is hard or not, determines your risk. Generally, newly formed plaques are soft plaques, but as plaques harden, the risk will decrease. So what I'm trying to say is this. For us, what's important is not so much how much your plaque is narrowing the artery, but whether your plaques are soft or not. Soft plaques are risky plaques. But plaques that have hardened through lifestyle changes and medication are generally plaques with reduced risk. And now I'm coming to the most important answer. Plaques do not disappear. Plaques never ever leave the artery. Only if they are very small, very soft, and treatment is started at a very early stage can they shrink to a size that cannot be detected by imaging methods. In other words, if plaques are caught and treated at a very early stage, they can shrink. And in fact, this is what matters most to us. The important thing is for the plaques to remain stable and not rupture, because when they rupture, cholesterol leaks into the vessel and our body tries to cover this leaked cholesterol with a clot to eliminate it. In other words, the most common cause of heart attacks is the sudden rupture of plaques and the formation of a clot on top of them. That's why what really matters for us is not whether you have plaques or not, but whether you are receiving appropriate treatment. But here's the good news. If you have plaques, they might be causing a 30% or 40% narrowing in the vessel. With proper medication, the amount of cholesterol inside the plaques can be reduced, almost like wringing out laundry, making them harder and significantly lowering the risk. So instead of thinking, if I have plaques, how can I get rid of them? You should be thinking, how can I keep them stable? How can I prevent these plaques from rupturing? That's what it means. And our two most powerful medications here are, one is a blood thinner and the others are statins. I know there are speculations about statins, but statins are among our most evidence-based drugs for protecting plaques. If you have plaques in your vessels and they are soft, with appropriate statin therapy, you can harden these plaques, prevent them from rupturing, and significantly reduce your risk of heart attack for the rest of your life. If you go online and type into a search engine, how do these disappear? Drugs that dissolve plaques, drugs that eliminate plaques, you will definitely see something. People are trying to make various elixirs, different treatments, and alternative therapies. In fact, even doctors are getting involved in this on social media. If you do this, your arteries will open up on their own. No, plaques do not disappear. Plaques do not regress on their own. We see this very often. The best treatment is an appropriate medical therapy. Plaques are a warning sign for you. If you pay attention to this warning, you can manage it well, change your lifestyle, and prevent it from rupturing. But if you do not receive proper treatment, the plaques will quickly grow and rupture. This can lead to a heart attack. So in summary, plaques do not disappear on their own, but with proper treatment, they can shrink. Therefore, ask your doctor for appropriate treatment, and please do not resort to alternative methods outside of the medication your doctor prescribes.